In India, 50% of all pregnant women are anemic. Hi, I'm Dr. Nivedita and I'm Senior Consultant Hematology and Bone Marrow Transplant at Max Hospital, Patparganj. So today we are going to talk about something that happens to be very common and especially impacts a woman's health during pregnancy. That is anemia. So what is anemia? Now anemia is a condition in which the healthy red cells in your blood are reduced and red cells contain a protein called hemoglobin. So this hemoglobin carries oxygen to all parts of the body. As a result, when you are anemic, the oxygen delivery to the body gets affected. So what happens when you are anemic? So when you are anemic, you start feeling very tired, lethargic. You don't have your usual energy to do your daily activities. People around you may start noticing that you're looking very pale. In fact, anemia can have a lot of cosmetic effects also. So you can have brittle nails, brittle hair, there can be a lot of hair loss. You might get dizziness on doing even slight exertion. You may get tired very easily. All of these are symptoms of anemia that you should take note of. So moving on, I'll be focusing more on anemia in pregnancy. And first we need to understand that what causes anemia in pregnancy. By far, the commonest cause of anemia during pregnancy is nutritional anemia, meaning a deficiency of iron and sometimes even deficiency of vitamin B12 and folic acid. So since most Indians have a predominantly vegetarian diet and even individuals who identify themselves as being non-vegetarian take it occasionally, we do tend to have a lot of nutritional deficiencies. Combined with that, the fact that there is high incidence of worm infestation, iron deficiency anemia is probably one of the commonest causes of anemia during pregnancy. And to add to that, the demands of a growing fetus, the placenta, they especially pose a pregnant woman to risk for iron deficiency anemia during pregnancy. Apart from that, there can be other causes of anemia during pregnancy, such as minor thalassemia, which is especially very prevalent in northern parts of the country. Along with that, we do need to know that sometimes anemia can also be a result of some sinister or more serious blood disorder, such as aplastic anemia or leukemia. So whenever a pregnant woman develops anemia, it is essential that a meticulous workup be done for her. So what can be the impact of anemia, both on the mother's health and the child's health? Now, it's a common myth that anemia can cause birth defects in the baby. But if the mother is anemic during pregnancy, there can be a variety of harmful effects. First of all, it is related to a higher incidence of preterm delivery. Apart from that, there can be low birth weight babies. There is also danger to the mother's health because her ability to tolerate blood loss at the time of delivery is compromised if the mother is anemic. In fact, there is data to show that maternal anemia is associated with both adverse maternal and fetal outcomes. So it is imperative that anemia must be treated during pregnancy, both for the sake of the mother and the unborn baby. And how can we do that? So our government in fact has a lot of reproductive and child health programs where all women are provided iron and B12 supplements free of cost at various government dispensaries. So be sure to take your vitamins, your prenatal vitamins very regularly. But since all anemia is not iron deficiency anemia, whenever you have more than mild anemia, whenever your hemoglobin level is reduced to say less than 10 gram per deciliter, it would not hurt to visit the doctor and get yourself thoroughly tested. So a doctor would perform a basic blood test of a complete blood count along with a peripheral smear examination to ascertain the exact cause of anemia. So those tests are very important in identifying the precise mechanism by which anemia is happening, because remember, anemia by itself is not a disease, it is a manifestation of an underlying disease. So to identify that disease and treat it appropriately is very important. As I mentioned, in our country, we have a high prevalence of thalassemia. So whenever a pregnant woman has anemia, we do a special blood test called hemoglobin HPLC to identify whether the lady is a carrier of minor thalassemia or not. And in case that test turns out to be positive, the husband must be tested for the same. Because if both the partners are carriers for thalassemia minor, there is a 25% risk in each pregnancy that the baby will be born with a serious blood disorder called thalassemia major. And this can be picked up in utero through appropriate prenatal diagnosis, and it can be managed accordingly. So to summarize, anemia is very common in our country and especially in women who are pregnant. It is possibly related to our predominantly vegetarian diet, some of our cultural practices like fasting, and possibly also due to a lack of sanitation and hygiene in some parts of the country. If you are pregnant, then you especially need to take care of yourself to protect yourself and your unborn child from the deleterious effects of anemia. So do take a healthy, well-balanced diet throughout pregnancy. Make sure that you're not missing out on the vitamins and iron supplements that have been prescribed by your doctor. But if still the cause of anemia remains unidentified, or if the anemia is severe, do consult a specialist hematologist to get more specialized blood tests done. Certain disorders like thalassemia minor during pregnancy can have potential consequences for the baby as well. So proper testing of both partners is necessary in that setting. And always remember that anemia by itself is not a disease. It is a symptom of an underlying disease which we need to identify and treat appropriately. I hope you liked this video and found it informative. But you have any doubts or questions, do comment below.